I want to say to the parents that might be listening who, like me, didn't have this information before, and maybe their kids have already undergone some medical experiences. It's so easy to feel ashamed and have so much guilt. But, we only know what we know. And so that's like, for me, one of the big reasons that I'm doing this work is I want to help parents know this. Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Thank you for being here and listening and watching this podcast episode. But before we go further into it, I want to let you know that there are some topics that we discuss that can be really triggering. There are stories of people's childhood medical trauma and the experiences that they had, as well as suicidal ideation. So if that feels like it may be too much for you today, please just pass this episode by. We have plenty of other great episodes on the Medical Trauma Support Podcast. Thanks. Hello, everyone. Welcome back to the Medical Trauma Support Podcast. Today, I have Christina Gonzalez on with me, and Christina is a social worker who wrote her graduate thesis on childhood medical trauma. Christina, thank you so much for being here and sharing your time and your work with us.
Thank you.
Yeah. So I wanted to kick things off by just asking you, what was it that made you want to write about childhood medical trauma for your thesis?
My own life, being a child who grew up chronically ill, not having been given any type of support from literally birth until I got a little bit older and was able to communicate that I was in pain, even though that wasn't believed for most of my life. I felt like I never really had a chance. I wasn't given that shot of health at all because I was born sick. My twin tried to kill me back in the womb, and we had a twin-to-twin transfusion syndrome, and I was dying and degrading. My sister was growing and flourishing, and I wasn't supposed to survive the pregnancy. But my mom delivered early so that we could both live. But that came with its own issues.
Yeah.
Almost like instantly, she always said that right when we came home from the hospital, I would not stop crying. Legs were twisted, were like kind of like just looking like not how a baby should, like their legs. Like instead of laying flat, it was like, I guess, curled, like twisted, always crying, wouldn't stop until I was swaddled extremely tight. She was a very good documenter and advocate for me. So she
Yeah.
knew something was wrong. And I went from doctor to doctor, and then finally when I was like 4, I got imaging done that showed I had cysts in my spine, which were causing a lot of my symptoms of like feeling like electricity, some twitching, a certain pain. But I always say that first MRI is what triggered everything, because I was 4 years old and
Yeah.
I was just taken to this big, I call it the big black building. I still call it to this day because I still live in town. So every time I see it, I'm like, oh, it's the big black building. But when I was 4, I had gotten my first set of scans, and there wasn't any child person to help. All I knew was that I was being forced into a room with a bunch of adults and getting threatened to stay still. Otherwise, they're going to put a needle in my arm. And it was a very aggressive experience being 4. And then for it to continue like every year, it was very troubling just because I didn't know what was happening and nothing was ever communicated to me in any way.
Yeah.
Growing up like in the dark.
Right.
Yeah.
That sounds so incredibly hard. And because I've talked to other people with childhood medical trauma, I know that wasn't unusual, unfortunately,
Yeah.
because it's like we didn't I think, fully realize that it would be helpful to explain it to the children. I think
Mhm.
oftentimes people made these choices thinking that they were protecting the kids by
Yeah,
keeping it from them. But we know that's not really true. Regardless of the kid's age, we need to be able to do age appropriate preparation as children are going into medical situations. And I'm sorry that that didn't happen for you, and I know it didn't happen for a lot of people, and
yeah.
I think a lot of it is because we just didn't know, but
I
that
think
doesn't take away the fact that you had that experience, right?
Yeah, I think people did know. That's the thing. I just think it wasn't cared enough. I think it's obvious when a child is like in distress because obviously like the kid is kicking, screaming, crying. I don't think it's that they didn't know. It's that who cares? They won't remember. It is more like dismissive, saying, "Oh, they'll forget about it." Like, kids have 2-second memories like hamsters. So they won't remember it by tomorrow. I think it was known, just not cared for enough to say maybe this will stay with them for the rest of their lives. Nope, they're just like, nope, kids are active, wild imagination. They'll forget it by tomorrow. So
Yeah, or kids are resilient.
that
The
one,
phrase kids are resilient. Yeah, I do think we've learned a lot, right? We are learning a lot. We're here talking about it, thank goodness, right? So we're all there are a lot of us, you and me and many others trying to change this now and make them better experiences for kids. But yeah, after kids have gone through that, then we're left like how do we then heal from that?
yeah,
What can we do to repair that? And I'm curious, like it makes so much sense why you would pick this topic for your thesis. And I'm curious if it felt reparative or helpful or healing in any way to be able to talk to other people for your study.
healing for sure.
Yeah.
I really didn't expect to hear almost like the same thing with every person, even though every person was so different, like different diagnoses. Somebody was in Canada, another one was in England, but like, so there are like three different healthcare systems being discussed
Yeah.
during this. And just to hear that, I was like, they would do that to a child in England. But then at the same time, I'm like, you know what? They would have done that here too.
Yeah.
So it was it was hard because there's a lot of things that I think hit me hard, like anything to do with twins
Yeah.
really gets me, and that was a case with one of my participants, and that broke my heart even more to have to hear that and then know that it happened. And it but at the same time, it was healing in a way just because I was like, "Oh, wow, all these people." There were so many of them. They all have the similar thing. Every single one of them said, like, every single one said they were impacted by this long
Hmm.
term, lifelong. And
Yes.
that's all I wanted to know, the majority of
Yeah.
it.
Yeah, I can see how that would be like it can feel so isolating, right? To have
Mhm,
experienced medical trauma, to have experienced something that the people that are around you don't really understand. And
mhm.
then when you're like you talk to somebody else who has been there and who gets it, there's this feeling of like it's not just me, I'm not alone. And I think that's so impactful. When I read your thesis, I thought you did such a great job of capturing people's experiences. And I was hoping that we could talk about some of the experiences that people had as kids.
Mhm.
Like the first one, the violation of bodily autonomy, and how that was really true for everyone across the board that
Yeah.
you talked to for your study.
Yes. My 3 sub-themes, all of them were found through, um uh through my research questions. Everybody had a very similar response. And so technically the theme violation of bodily autonomy was not even a question. It's just what came up with
Yeah.
every single person from my first research question, and which was, how does living with a chronic medical condition during childhood contribute to the development of trauma as conceptualized within the ACEs framework? And then what are the long-term impacts of childhood medical trauma on individuals and adults? And so
Mhm.
those two questions gave way to the answers that became our major themes and sub themes. And the first and most prevalent one, and the most, in my opinion, horrific one, was the violation of bodily autonomy.
Hmm.
And this one was about every single person, and every single participant explained that how traumatizing it was to have their body undergo forced medicalization, forced procedures against their will as children, not even being restrained. Um
Hmm.
and that part, that got me too, because when I was hearing that, I was just remembering these really rude men working in radiology, literally, like, threatening me with the needle, and so that made it harder, but anyways, or a lot of them had extreme, like, very similar responses to the same question, even though it wasn't prompted. Like,
Hmm.
it was nuts. Everybody had a case of something being forced against them, whether it was like a catheter being inserted, or it was a needle, or a surgery being done with no anesthesia, or things of that sort. And then with the violation of bodily autonomy was also the painful procedure being done with no explanation. Like,
Yes.
keeping
Yeah.
the child in the dark, that's something every single participant said was what made them feel like there was a violation of their autonomy, that they were not included in the conversations that were happening. There was one where there were many, many different attempts to get an IV into her arm,
Hmm.
and
Hmm.
as a kid, you're just like, "Why on earth are you stabbing me so many times?"
Right.
And nothing was being done to comfort or explain, like, "We need to do this to test, like, we you gotta get this done."
Yeah.
So not being
And
informed.
yeah, one thing I think about with childhood medical trauma is because we don't, at least up to this point,
Mhm,
a lot of people don't understand that actually having the conversation with your child, and even if they're too young to have like a full conversation
mhm,
about it, but explaining what is happening, that's not going to make it harder for your kid. Like it's already hard, but it's also I think it can feel like such a betrayal
it does.
because these really hard things are happening and your parents are standing by. And sometimes they're the ones helping you be restrained, right? So there may be
Yeah,
some nurses and your parents restraining you. And if no one's explaining what's happening, not that I wish that restraining was not even a thing, right?
no,
But I'm saying in these situations, even for somebody to be like saying, I'm holding your arm right now because I'm afraid that if you yank your arm, it's going to hurt you more. Just saying that and saying, yeah, I'm holding your arm right now. And why I'm holding your arm can make such a big difference.
mhm,
And I think about this because, I've shared with you when we met that I got into this because of one of my children's medical trauma.
mhm,
And no one told me what medical trauma was. No one told me that there could be emotional implications from it.
mhm,
And so when I look back, I think my little baby thought that I was over here just standing by while they were being hurt. And so looking at it from this perspective and talking about this, I think is so important. And also I want to say to like the parents that might be listening, who, like me, didn't have this information before, and maybe their kids have already undergone some medical experiences. It's so easy to feel so ashamed and like have so much guilt. But, we only know what we know. And so that's like, for me, one of the big reasons that I'm doing this work is I want to help parents know this before
mhm,
their kids go in for medical experiences so we can give you know, information, ideas, like things that parents can do to help their kids, support them as they're navigating these really hard things, these really hard
mhm.
medical experiences. Yeah, the violation of bodily autonomy, I think anybody listening can understand why that would be traumatic, right? And then I want to go to one of your other main sections, and that was emotional neglect and dehumanization. This experience that the people in your study shared.
Yes. That one was our second major theme that was found through the research questions. It came with two different sub-themes of clinical objectification and dismissal, where this came specifically from a participant who explained that they felt like they were just a test subject. This was a child clinical trial who was not being informed exactly why are they taking samples from my kidneys with no pain medicine? Like, why am I feeling this? Why am I being experimented on and not being told what it's for? So this child, or adult now, but child at the time, felt like she was nothing but a test subject for these people and that her comfort wasn't even considered, even with multiple different requests of, can you help me? Can you do something to make me more comfortable? It was ignored. And then the dismissal came from one story of a participant who was autistic and said that they had nurses who would mock them for being autistic and having a meltdown, in their terms, meltdown during medical stays because they were so overwhelmed. And
Yeah.
instead of that being treated with like, oh, let's give them some space, let's let them calm down, it was more like, get it together, you need to do this, or very cold reactions from hospital staff.
Yeah.
And the absence of mental health support came because that's the second symptom. And a lot of the participants mentioned feelings of suicide as
Mm,
children.
yeah.
A majority of them, one of them at age 13, made a promise to themselves saying that if by this time I'm not better, I'll kill myself. And I think that one stuck with me the most because I said the same exact thing. When I was 12, 11 or 12, I gave myself a ultimatum. I said, if I'm by the time I turn 18, if I'm still in pain, I'm gonna end it. I had plans for years. And so hearing that, this person was 13 and she said that if by the time she starts high school and she's still feeling the way she does, she will not live. She will not allow herself to. And so
Yeah.
there was a complete absence of any type of like follow up, like to see like a child on independent study, um no kid, like classmates, no teachers, no socialization while you're in the hospital by yourself as a teenager, a young teenager, where friends are everything at that time. Like, and when you're missing that, that is the major trauma that also spoke to me as well. One of the main things a participant said was that they felt that doctors were mainly trying to save the body while abandoning their emotional care. And this compounded even more harm on them.
For people listening, this is such a hard topic, right?
Hmm.
We're talking about children who were in so much pain, both emotional and sometimes physical as well, that they were talking about and had plans to kill themselves. That's hard, right? That's hard for people to hear, but I think it also really makes it clear how important it is that we take care of the mental health of children undergoing medical treatment. I mean, the mental health is health. It is a huge part of who we are. And so while I mean, this is, it's like painful, right? To even think about this, it's painful to hear it.
Hmm.
It's real, right? This is real. These are people's real stories. And it's important for anybody working in medicine, at all different levels, right? Like social workers like us, like
Hmm.
they need to know about this. Doctors, nurses, PAs, like it's important that everybody is aware of the really significant mental health impact that childhood medical experiences can have on people. And I guess, we also should say, which we didn't start out saying, is that everybody in your study, everybody that you spoke to was an adult.
Hmm.
They'd all experienced this trauma as children, but you were interviewing people that were in various ages of adulthood.
Yes, everybody was over 18. They're all adults. Every single one of them had a diagnosis ranging from being only a couple months old to being a teenager when they got sick, or being, I believe one of them was about 2 years old. So they were all ranging in ages from when their trauma happened. And one of them was, she, because of her age, she mentioned that technically she can't even really remember what happened. She just remembers the fear that she had with her,
Hmm.
even if she couldn't remember certain moments because
Yeah. And
of being
and
too.
I feel like Right. And also, sometimes people who experience this when they're young, or even people who've gone under anesthesia, may have nightmares about it. So even if they can't remember the specific things that happen, they may have nightmares of a dark room. Or
She said that she would have these nightmares that made her feel like she was stuck in the dark and she was in the
yes,
hospital. There's a term she used. It was like something people use when they describe nightmares to an extreme, but she said that it was basically mirroring everything she was trying to forget while
yeah,
being alone and alone at home, recovering from her diagnoses and trying to recover in general. Nightmares were a big part of that specific one, because if they had gotten more than likely if they had gotten any mental health care, maybe they wouldn't be processing all this during dreams. Like they would have been able to get it out, like, and work through it rather than dream about it while also living it.
yeah.
It Yeah, that was a big thing.
Yeah, yeah. I think mental health care and really spending time to be with people in their emotions, both during procedures and medical events, and as well as like after, is so important, because oftentimes during the event, we don't have the bandwidth to process it, right? What we need is we need someone just to be there with us, like be attuned, be co regulated, and be there with us. After the event is typically when there is some bandwidth to start to process what has happened. And I agree with you that having that mental health care within the medical system is so crucial to helping kids and adults live without PTSD and all of the things that come along with that. It's so hard, and nightmares is such a common piece to that. So far, we've covered two of your three main areas that you found through this study, and that was violation bodily autonomy, emotional neglect and dehumanization, and your third one was institutional and family betrayal. And I guess we touched a tiny bit on that feeling of betrayal, but I'd love for you to go a little bit more in depth in some of the subtopics that fall under that.
So the first sub theme was not being believed or taken seriously. This came from a lot of the participants explaining how, well, this was mainly like in a way, like the older ones who were able to verbally express their symptoms, of being just not believed, being told it's growing pains, it's something that happens when you grow up, like it's normal pain. Or one of them specifically, in a way, it wasn't themselves being not believed, it was her mother.
Ugh,
A case of the identical twins, who one of them was diagnosed, thankfully, very early with her neuroblastoma,
mhm.
and her mother had concerns about her twin sister possibly also having it, but doctors said no without checking. And so the twin went undiagnosed for a while until it was finally caught, but at that time it was stage 4 and nothing could be done, and the twin died. So it wasn't like the child wasn't being taken seriously, it was the mother. The concerns were pushed away because it was probably more than likely, like, "Oh, you're just paranoid because of the first one."
Yeah,
Yeah,
yeah. And like,
that.
that really makes me think about the fact that when a kid is going through a medical experience,
Mhm,
the parents are also significantly impacted. Parents oftentimes feel completely helpless, out of control, absolutely terrified. I'm talking about my experience too as a
mhm,
parent. Parents love nothing more in this world, nothing more than their kids, right? So when there's something going on medically with your child, it's terrifying. When a child is having a medical experience, the whole family is impacted. The parents are impacted, the siblings are impacted. All of the people that love that child are really impacted. And I think for parents, just your whole life is also disrupted. You're doing everything you can to care for your child. You're witnessing your child in pain.
mhm.
We talked about restraining earlier. There are times you witness your child being restrained, and it's horrible. It's horrible. And yeah, there are things that we can do to make it a little bit better on the child, and there are things we can help support the parent in,
Mhm.
nervous system regulation. But even with all of that, it is such a hard experience. And so I think probably a lot of people that are going to listen to this know that experience, but there may be people who haven't had that experience. And so I just like, I want to spread awareness, right? I want people to understand what their neighbors and their people in their community are going through, because what families going through this really need is so much support, both during the medical treatment as well as after the medical treatment. So I know I interrupted you, but that just, I just think that's so important for people to understand.
Yeah. I that that specific part of not being believed or taken seriously on account of the parents' perspective, that one really got
Yeah.
me because that's something that happened with me as well.
Yeah.
My mom had a traumatic pregnancy, being told that one of her babies wasn't going to survive. So
Yeah.
once we were born and there was obviously something wrong with me, is she was very much gaslighted into thinking, no, you're just afraid because you had a bad pregnancy. You're just making it up because you're paranoid because you're a first time mom. And but no, she was not paranoid.
Yeah.
There was something wrong as an infant, like, and then being a twin, you can see an obvious one twin is, flourishing. The other one is like literally like screaming in pain and shaking and won't calm down unless they're tightly swaddled.
Yeah.
Wasn't able to walk for a very long time, unlike my sister,
Yeah.
until I had to go into physical therapy. Like, my mom had been completely pushed aside, gaslit by so many other doctors. And so that part of the not being believed and taken seriously, I liked that sub-theme because I heard from both kids who were saying they weren't taken seriously, but then also hearing that there was a parent part too, because
Yeah.
the parents trying to get, help for their child
Yeah.
were pushed aside or ignored. And then once it came to the child trying to literally help themselves, it's the same thing, pushed aside. You're too young. What do you know? And especially if they were like young teenage girls, which was actually my entire population were female. That wasn't intentional though. That I advertised my participant notice, and that's just who signed up. So it wasn't
Mm,
intentionally all female. It's just what who applied. But yeah, I that specific sub theme spoke to both parents and the kids. And
right.
I think that's why it bothered me so much because I was just like almost every single well, actually every single person, yeah. That's why it's one of the third themes because every single participant said this happened to us too. And
Yeah.
it just made me so mad.
Yeah.
Still does.
And I feel like, and it makes sense, right?
Mhm.
When your experience that felt so traumatic to your body, right? When you hear it from other people, it makes so much sense that you're going to feel that charge and that anger of not being listened to. And, the other one, I think we talked a little bit about this too already, was the withholding of information by parents or providers. And
Yeah.
how, I think, like, I truly believe that everybody's doing their best every day, right? I just, that's how I live my life. I think everybody's doing the best they can in that moment. And so I do think that parents either just didn't know that they should share the information with their kids, or they thought about it and they thought, I think the best thing to do for them would be not to tell them.
Yeah.
And I'm curious about how that came out in your study with the participants and how they talked about that.
So every single one of them said that their medical treatments, their diagnoses were kept from them
Mm,
for a majority of their life. Like, one of my participants, what the twin, she explained that when she got older, people would ask questions about her diagnosis and her treatments. She didn't know anything
mm,
about what happened at all. So
mhm.
people were saying, how do you not know what happened to you? And the answer was, "How could I? My parents didn't tell me anything." Everything was kept from her. Anytime that there was a test done, like results, asking about it, "You don't need to worry about that." And every single participant had a very similar story, whether it's cancer or a test being done or a specific diagnosis. It was, "Oh, you don't need to know." There was an instance of, this one participant who her, like, medical team were doing, like, this whole discussion, and she was told, Can you wait outside?"
Mm,
And ironically, that also happened to me too. And so I remembered that. I was just thinking, "Why are these people talking about me behind my back?" I mean, like,
yeah.
not, like, in a gossipy way, but, like, why can't I know? And that was
Right, because it's about your body, it's about
yeah,
you.
and
Yeah.
all of them said very similar things, that they would ask about results or about, "Well, what is this pill you're giving me?" Or, "What is this surgery for?" Or, "What's a biopsy?" Like, things like what they were gonna have done to them rather than it being explained was like, "Oh, don't worry about it. Just it's okay. You won't feel it." Or
Mm,
anything that was in a way dismissive. I don't think it was like, hearing it, it's obviously dismissive, but I don't think it was meant to be
mhm.
purposely by
Yeah.
the parents, by doctors, by whoever was in the room that wasn't the child. Like, it was a very dismissive category that came from the sub-theme of everybody relating to that being dismissed, even though you're the patient.
Yeah.
Test results being excluded, everything.
Yeah, so I think that, it's really important that we can get informed consent from kids as much as is possible, depending on, it's going to be age appropriate, right? Again, this content is hard. It's so hard to hear these really challenging experiences that people have gone through and that they went through as kids and
Mhm,
the way that they remember them, even if the adults in the room were doing their best to take care of them, it didn't feel that way to the kids, right? And so I really want to make sure that we have time to talk about the implications of the study. I think it's really impactful for people to hear real stories like you shared, like your thesis and your study was qualitative study, with questions you asked people who'd had this experience. And then I think it's really important for us to take that information and think, what can we do with this? Right. So I would love for us to talk a little bit about the implications from your study.
so there was one more sub-theme, it was loss, and I think it goes with the implications. It was loss of safety in care settings.
Hmm.
That was the last sub-theme
Yeah.
of the 3rd major theme, which connects to the betrayal trauma theory. And,
Yeah.
it was where participants explained that they had PTSD responses, panic attacks, and which later in life led them to avoid medical care, seeking any
Yes.
form of being near a doctor or a medical facility. That this lifelong betrayal stayed with them even as adults, to where they couldn't trust medical staff or places anymore.
Yes. Yes. Christina, this is such a big one, the avoidance of care, right? And there are a lot of people who avoid medical care. And it makes sense when they've had the experiences that you've shared that the people in your study experience. Like, it makes sense that it would be really hard to walk back into care settings and to avoid any medical, not only procedures, but even just like medical checkups, because your nervous system, your body remembers how dangerous those places feel, right? And the
Yes.
things that happened, the pain and the, lack of informed consent and not having your voice heard, it makes sense.
There was a quote, that I really liked. It says, "When both families and medical institutions failed to protect us kids, the betrayal was just as traumatic as the illness itself."
Mm,
And I like that one because
yeah,
I agree. I think that, I mean, shoot, that summarizes my entire paper. Like, that's the point of it. Like, it's
yeah,
an entire thing that is a failure for kids, that
yeah,
is failing kids. I mean it's still happening, but not as much. I love seeing all these resources out there, like all these like child life specialists that I follow, how they post all these like kid explaining like a MRI, um or EEG, like things like that. I love that.
I think it's really beautiful that we have learned, right? We have learned over the years that some of these things that we that have been done in the medical settings were really harmful for kids.
Mhm.
We know kids remember, and even if their brain, even if like their the cognitive part of their brain or their memories aren't necessarily there, that they can, put into words or be really clear about, we know that our bodies hold on to these experiences.
Mhm.
So many people, when they're triggered, it's often through like sensory kind of memories. So like a smell from the hospital, or even like the sound of beeping. So you may not have a memory necessarily in your mind of the experience. Like you said, when woman doesn't remember exactly what happened, but she has nightmares.
Yes.
We know this now, thank goodness. And I do think child life specialists are amazing, and the work that they do is amazing. And just like also you writing this thesis and putting this information there, I think is so important, right? Because you're sharing people's true stories of what they've gone through. And I think it helps us
Mhm.
as we're moving forward think about, well, what can we do to make this child who's in this situation, what can we do to make this child's experience better?
Mhm.
So it's like, it's so hard to know that these things have happened, and so many children have gone through them.
Mhm.
Also, we can make changes to make these experiences better than they were for you and the people in your study.
Mhm.
And you're doing the work, you're in there doing the work to help make that happen and to help make the changes happen. And, to go to the implications of the study, I'd love for you to share some of that. And I know a big part of your paper was talking about how including medical trauma in the ACEs is a huge part of that. So I'd love to hear more about that.
Something that I found was that with the ACEs, there are very similar long-term characteristics of people who say they were abused as a child or they were abandoned, or the most typical ones of like drug abuse in the home,
Hmm.
alcohol abuse or sexual abuse, physical abuse, all of those, that their later outcomes in life were significantly impacted. And the way I saw it was that so were these kids who are forced to grow up in a hospital, being touched without their consent, being forced to take medications, and they were all extremely similar in my the findings, because with the ACEs it shows how like abuse, neglect, and family dysfunction affect your lifelong health.
Hmm.
But in this case, it's showing that medical trauma can affect your lifelong health, not just the traumas of coming from neglect, poverty, and family dysfunction. Like there's another area that affects a person's long-time health, and that is those who endure medical trauma. Well, children.
Hmm.
And it really bothered me because when I was looking for resources to write this, I could not find much. It
Hmm.
was a majority of the paperworks that I found were about parents, and
Hmm.
that's what
Hmm.
really upset me,
Hmm.
because that the parent is not the one experiencing it.
Hmm.
Only the child knows what they are feeling and thinking.
Hmm.
They used, the pediatric, medical traumatic stress syndrome, something
Hmm.
like that, but even then, it wasn't as much as I was hoping to find.
Yeah.
A lot of it was outdated from what was it? It was there had been some article about how it was only maybe about 30, 40 years ago that medical professionals started believing that children could feel pain, that young children could feel pain.
Mhm.
And so that's
Mhm.
why a lot of children were give were given like surgery with no anesthetic, no pain meds. And I mean, I wasn't even born during that time yet. Just hearing that, I'm like, that was only like at least maybe 40 years ago, and they really didn't know that young children can feel pain.
Yes.
That bamboozled me.
Like, as people are working and new studies come out,
Mhm.
you learn things, right? And my guess is there are probably doctors who
Mhm.
were operating under the assumption that children couldn't feel pain.
That's what
And then when
happened.
you learn that they can, my gosh, I can't imagine being that doctor that thinks back to the 20 years of practicing with the belief that like children can't feel it or that they won't remember the pain and then learning that they do. That's got to be absolutely heartbreaking. And
Yeah.
it also makes me think about the people who are, in their 50s, 60s, 70s, who may be listening to this and who may have had that experience in their childhood. And maybe this is one of the first times they're hearing anybody talk about it.
Mhm.
And so I think it is really important that we're having this conversation, as
Mhm.
painful as it is. And I also had the same experience you did, because, I also did an independent research project in my master's of social work program,
Mhm.
and I had the same experience you did of, there's really not a lot of information out there on medical trauma. There's some information you can find. There's more that's coming out. There are some
Yeah.
amazing researchers looking at medical trauma, but there's still so much more to be done. And that was, I did my study because I didn't know that I would go into this, right? I just was trying to find information to help my child and to help me,
Mhm.
about, like, what was that? What is happening? What is this thing?
Mhm.
How can resources that can help us? And, if you think that the research is very limited, the support, the resources that people can go to find support are like almost non-existent, or at least were when I was looking for it, which is why I created this. This is literally why I started medical trauma support, is because I could not find the resources that I needed to
Mhm.
help myself and to help my child. And so, I just think the work that we're both doing is really important, because we're still at, like, we're early in, I think we're really early in
Mhm.
this process of looking at these medical experiences that we've had, whether as children or adults, looking at the impacts of them, looking at what kind of interventions can be done. I think we can all agree that having mental health care as part of your entire care picture
Mhm.
is vital, right? We know, like, that's so hugely important. And we also know that that's not happening in most places. There are some amazing clinics and hospitals that are really thinking about mental health, but that's not happening everywhere. But I just think, Christina, about all the people you talk to and the impact that having somebody there that was solely focused on their emotions and their mental health, and how different their stories could have been. Because while childhood medical trauma can be really impactful and painful, I do have a very deep belief that we can also heal from it. And so, I would love for you to talk a little bit about the implications of this study as we wrap up this episode today. But I also want the listeners to know that I'll have a link to your project, to your thesis, in the show notes.
So what we found was that for micro implications, that there should be social workers and clinicians to screen for medical trauma and validate it as real. That came because even now as an adult, when I went to the doctor's office, so ironic. When I went to the doctor's office as I was doing my thesis, they gave me this paperwork that they have never given me before. It was the ACEs. And they were asking me, did you experience childhood sexual abuse, physical abuse, starvation, listing all these traumatic events within the ACEs. And I was looking at that and I said, oh my goodness, I am talking about this right now. I have never been given that paper a day in my life. And it wasn't even a year ago yet. It was in January. And they had given me this paper to fill out. And I added my own category and I wrote medical trauma and check. But just the fact that they gave me that as an adult, I was thinking, shoot, we're at a doctor's office right now. Nobody sees how they're missing something. But I think that's also why I think the ACEs needs to be expanded. For the micro implications, we are stating that in children's hospitals, there should be social workers or clinicians who can screen for medical trauma because
Yes.
they often have workers coming in asking about, like, "How are you doing today?" Like, "What's your pain level?" Well,
Yeah.
there should also be something where it's more like, "What about how you mentally feeling?"
Yes.
But in kids, of course, kid appropriate ways,
Yeah.
depending on the age and everything of the child.
Right.
So, that was something that came up, and then for the mezzo, we said that there needs to be more trauma-informed practices in pediatric care with child-centered communication, emotional support, and parent advocacy. And I liked that this one was also something to include the parents because
Mhm.
it is the child's community and ways that they can understand the language, and then
Mhm.
acknowledging their emotional fears, and then also including their parents
Yes.
to all work together with that. And then the macro implications were that there needs to be an expansion of the ACEs framework to include medical trauma,
Right.
policy, and institutional reforms because everything that I have seen and heard, really think there needs to be a change in not just the ACEs, but these survival only models of care are not what they should be. It doesn't protect the dignity or the psychological welfare of a child. It
Mhm.
shouldn't be just about surviving. The mental care was left behind. Like, while their physical disease was cured, like chemo, radiation, their mental self was not supported. It was left behind.
Mental health is as much a part of us as any physical health.
Yeah,
And it has huge impacts, like you said. The not treating and not caring for our mental health and our emotional health has implications on our physical body as well.
yes.
It's very bizarre to me that we've ever tried to separate it. It's all
I
the
know.
same. We're one person. We're this like, we need to be treated as a whole person,
I've
right?
never understood it. Like, I've never understood the inability to think that kids could possibly have like a psychological response because
Absolutely.
that's why I have all these participants because
Yeah.
that was not taken care of for them.
Right, right. Well, I'm so thankful that you've shared this with us. I'll have a link to your thesis in the show notes. I'll have a link to ACEs for people that are curious about what that is. But before we wrap up, I'm curious if there is, something that you want to leave the listeners with, like a piece of information that you think is absolutely vital on this topic.
Think that anybody who has a child who's going through chronic illness or cancer or any type of medical procedure needs to know that the biggest thing is that their child is not too young to not be scared. You can think your kid is not going to remember, but they will. I've read quite a bit of comments and posts in general of children who saying that, oh, they woke up from anesthesia, they don't remember anything. But just I want people to know that it's very devastating to have to live in a medical world and then basically just have to heal your emotional wounds by yourself later in
Yeah.
life because you weren't given that chance when you were a kid going through it. It's very isolating and damaging, and that if that is a child who you know, then there needs to be an earlier intervention
Yes.
to help that child.
Yeah, I agree. And I think the parents need a lot of support to be able to do that. So
Mhm.
that's really important to me and something that I've been thinking a lot about and working on resources for parents because I think when we can offer support and we can offer education and resources to parents, then they are then able to understand what their child needs within the medical world, right? Like, parents and children are often so attuned and parents can listen to their intuition, but there are things as we navigate the medical systems that I think just getting a little bit of education can help parents to be able to process this and to feel supported and to understand what's going on with them. And for the kids to feel like they're a part of the medical decisions and the medical journey that they're going on.
Mhm.
Thank you, Christina, so much for sharing your time. It was really good to talk with you today.
Thank you for asking me.
Yeah. Thank you so much for listening to this episode where we talked with Christina Gonzalez about her master's thesis on childhood medical trauma. And I would love to hear your comments on it. So if you would comment below this video, I would love to get a conversation started. I want to hear your stories and I want to hear what some of the things are that you would love to have change in the medical system. Thank you so much for listening.